Out, right? Oh, there we go. So welcome again to our April webinar. I'm really excited tonight because we have a recent graduate of our program who's going to be speaking about his capstone. So really excited to have Austin back. We really don't have too much program news to share with you right now. Um, Next month is commencement, so if you are graduating, we look forward to seeing you there. Make sure you check your email because you're going to be getting a bunch of emails from Rachel about that. Um, Happy National Public Health Week. Um, I put something on LinkedIn talking about how great all of our students are. So again, we do appreciate everything that you are doing in and out of the classroom. And I think those are really the only two announcements that I had. Next month is going to be our last webinar until September. So next month, our webinar is going to be on the 4th. And I have somebody who um, it is in the National Guard, and she's been doing a ton with the COVID response. So I met her on LinkedIn. She had posted some really interesting stuff, and I reached out and asked if she would be willing to speak. And she agreed. She's really excited about it. But the stuff that she posts is really interesting. So I'm looking forward to hearing her talk about both her personal experiences working with the National Guard, but also she's doing research on the National Guard and its response, like in things like this, for her dissertation. So she's got both a professional and an academic perspective on this, which will be exciting to see. So I don't have anything else really announcement wise, so we can jump right in. As I mentioned, tonight we've got a recent graduate of our program, which is always really exciting to get to spotlight some of the great work that our students do. So Austin Boccardi coordinates the hazmat and decon protocols and exercises at St. Luke's University Health Network's Bethlehem campus. He also trains clinical staff in decon and PPE procedures. He's an alum of our program, and he completed his capstone entitled A Comprehensive Performance Assessment for an Eastern Pennsylvania Hospital's EMS and MCI, Identifying Gaps and Recommendations for Best Practices. The findings of his capstone led to meaningful changes in the EMS department, and he contributes to several emergency management committees in his hospital security role within the network, including the Joint Commission Revised Standards Task Force. And he's going to be joining us today to outline his capstone project from conceptualization to implementation to serve as a model for future research. So Austin, thank you so much for coming and speaking tonight. And you should be able to share your screen.
Thanks, Jen, for that introduction there. I'm gonna leave my camera off because for some reason I always have better connection when I'm not sharing my video. So I apologize for that. Hopefully I don't cut out throughout this presentation, but just give me a second to get the screen shared and set up. And then I'll get started. I do have a lot to say here. So hopefully I can get through it all pretty quickly. I apologize. I probably could have done a better job of breaking it down for everyone, but I kind of get excited about it and have a lot to share. So can everyone see that okay now? Okay.
Yes.
So as mentioned, good evening, everyone. My name is Austin Boccardi, and I'm a recent graduate of this program. I graduated in the summer of 2021 and currently work as a hospital security officer and a decontamination coordinator, as Jen said. I do sit on several emergency management committees within that hospital, and I participate in numerous exercises with them. My future goal is to focus in hospital emergency management. Today, I'm going to be speaking to you about my capstone project. For the purposes of this presentation, I redacted the name of the hospital, so it will be referred to as an Eastern PA hospital. I also have to thank Dr. Eugene and Dr. Gavin for the completion of this project, because without them, it wouldn't have been possible. They were both valuable mentors throughout this process for me. So thank you again to them. Prior to the project itself, I was approached by an Eastern PA hospital to look into their MCI response plan and help their EMS crews identify critical tasks during a mass casualty incident and create some type of job action sheet or checklist for them. So I needed to come up with a way as to fit the capstone requirements since I wanted to use this as part of my project. The results um, ended up being a research project, which is titled a comprehensive performance assessment for an Eastern PA hospital's EMS and MCI, identifying gaps and recommendations for best practices. Literature review. So I began doing my research into the following key terms. I use these key terms to collect research on past mass casualty incidents, lessons learned, EMS, emergency preparedness, several other things. I won't go over all of them because that's going to be very cumbersome and probably boring to many of you. However, two big takeaways for this project that I want to talk about is MCI and performance assessment. So MCI, an MCI is an event which generates more patients at one time than locally available resources can manage using routine procedures. MCIs usually result from a disaster event. Disaster event occurs when a community's capacity is crippled to where external assistance is needed to restore the community back to normal operations. Hence, the level of preparedness determines how catastrophic a disaster's outcomes are. Learning from past disasters has helped us become more prepared. Previous large-scale disaster events such as 9/11, the Boston Marathon bombing, Las Vegas mass shooting, and so forth have identified gaps in preparedness and paved the way for organizations to understand preparedness on a whole new level. All these events have had MCI components to them. While these disasters occurred on large scales, local agencies can adapt and adopt these lessons to support an all-hazard response. This was part of my goal to help entities apply large-scale lessons to things that they would probably be experiencing on their own levels. MCIs aren't always hundreds of people, but can be motor vehicle accidents with multiple cars involved. This was something recent that just happened on I-81, if everyone recalls, with that snow squabble that we had a couple weeks ago. So this plays right into that. Now, performance assessment, that's the other part of this slide. I needed to figure out a way to test this Eastern PA hospital's EMS knowledge and abilities when it came to MCIs. So with the help of Dr. Gavin, it was suggested that I use, modify, or even create my own performance assessment to improve the EMS's responses for MCIs. I was pointed toward looking into the National Public Health Preparedness Standards, where I could use or create a set of performance standards to be assessed. Now, while National Public Health Preparedness Standards is focused on public health operations as a whole, this was still critical to review in order to assess the performances in MCI responses. I needed to know more about these standards and where they came from if I was able to conduct my research. So the National Public Health Preparedness Standards History and Framework. By the latter half of the 1990s, research observations found a lack of consensus as to the content of public health practices is perhaps the most important barrier to effective public health action. It was also discovered that creating public health performance standards and an accreditation process would augment the public's knowledge, accuracy, and gratitude of public health responsibilities. In identifying standards, organizations are able to evaluate performance, measure their capabilities, and discover weaknesses that can be improved for the future. This means they are able to make quality improvements in their responses over time. Hence, the National Public Health Preparedness Standards was born, creating evidence-based standards and benchmarks across the field of public health, resulting in what is known as the essential public health services. National Public Health Preparedness Standards administrators classified public health systems to include all public, private, and volunteer entities that contribute to the public health activities within that given area. The purpose of public health systems is to protect the public's health and stop the spread of disease. Public health assessments, like this National Public Health Preparedness Standard, assures the public that the public health system's design is working. The stronger our public health system is, the more resilient we are to disasters. As you can see within the system is EMS. Today, the National Public Health Preparedness Standards provides toolkits to assess and analyze all parts of the public health system, making it more flexible than ever before. The most up-to-date list of these essential services are as followed. Number 1, assess. Number 2, investigate. Number 3, communicate effectively. Number 4, strengthen, support, and mobilize. Number 5, create, champion, and implement policies. Number 6, utilize legal and regulatory actions. Number 7, ensure an effective system. Number 8, build and support a diverse and skilled public health workforce. Number 9, improve and innovate. And lastly, number 10, build and maintain. Based on these essential services, National Public Health Preparedness Standards Assessment answers 2 questions. What are our capabilities of our system, and how well are we providing those essential services? In answering these questions, agencies can identify gaps in services and the system, create awareness of those gaps, and promote a willingness to share information with others. Ideal performance equates to creating stronger responses, allowing people to recover faster and get back to a normal life. Being prepared for an MCI. When it comes to public health preparedness and disasters, first responders need to understand a variety of different emergency situations, know their capabilities and resources, and be able to quickly put a plan into action. The longer a response takes, the worse the disaster may become. Therefore, it is critical that emergency responders be prepared for all hazards. Within the public health system, emergency medical services, or as we know, EMS, are critical in determining how catastrophic a disaster will turn out. EMS, by definition, is an elaborate system that provides emergency medical care through many different agencies and organizations. EMS are most likely the first to arrive on a scene of any situation and provide pre-hospital assessments and treatments such as patient triage, stabilization, and transportation. MCIs require proper activation, communication, scene control, chain of command, triage, and inventory. Without effective coordination and collaboration, disasters like MCIs become even more disastrous. Poor performance here negatively affects public health. The escalation of an MCI to a larger disaster is not ideal. Literature supports that many deaths are preventable. Other challenges. Further research has identified that planning for MCIs requires a straightforward yet well-tested strategy based on the routine operation of the existing EMS system. Creating a performance assessment similar to the National Public Health Preparedness Standard would be a perfect way to implement this, which would strengthen the field of public health preparedness. Since disasters and MCIs don't happen regularly, EMS face several challenges besides just being prepared. Some of those challenges involve hazard awareness, communication, and triage. Creating performance standards would help EMS departments improve their quality in all these areas. Hazard awareness. The key to preparedness is being aware of the hazards one is vulnerable to. Unfortunately, many EMS systems struggle in determining their MCI vulnerabilities because they do not have a set of performance standards to evaluate against. Vulnerability is the battle between susceptibility and resilience, or in other words, the exposure to a risk versus the ability to overcome that risk. By knowing one's own strengths, weaknesses, opportunities, and threats, as well as maybe even their neighbors, EMS departments can close the gaps, enhance communication, and improve the quality of future MCI responses and care. Communication challenge. While preparedness is key to recognizing how to handle a situation, communication is the cornerstone to ensuring a response runs smoothly. Breakdown in communication is problematic and may cause a ripple effect of issues. During an MCI, it is important to avoid changes in command or communication officials because it creates confusion among the field operators and responders and guarantees some type of loss of information. Triage challenge. In an MCI, triage is critical to the success of the response and the survival of victims. Some of the more common triage methods are START, or simple triage and rapid treatment, or SALT, sort, assess, life-saving intervention, treatments, and or transportation. These skills are often forgotten as it is not regularly used. In a study, it was found that after 1 year, paramedics' accuracy significantly decreased in assigning the triage category, as well as airway and bleeding handling measures. Overall, triage capabilities diminished from the initial training and required retraining to reestablish the quality, which you can see in figure 2 there. The pass rate for certification dropped from 91% to 50% and increased subsequently to retraining to 89%, which is seen in figure 3. The results of these findings are clear. Yearly training and performance evaluations are necessary for EMS to be prepared and successful in an MCI. Furthermore, transportation is often not considered or its significance is forgotten. To have a systematic flow of victims reduces the time it takes to transport a patient and is critical to their overall care. Victims should be grouped together according to their triage level so that the identification of those in need of critical care can be easily found and monitored. The traditional approach to this is rescue, triage, and basic emergency care take place at the disaster site. Then ambulances take the patient directly to the hospital or treatment center. Rationale and justification. The purpose of the National Public Health Preparedness Standard assessments is to describe an optimal level of performance and capacity to which public health should aspire. It helps local entities identify areas of improvement, supports local partnerships, and provides effective delivery of services and responses to emergencies by improving communication and collaboration, providing education on public health and its activities, strengthening the network, and addressing quality improvements, providing baselines for performance measures, and establishing a model for public health. Creating and providing a set of standards allows entities to establish evidence-based guidelines to improve their responses and processes. Many organizations at all levels have taken on this assessment to answer a variety of questions about their public health systems, capacities, and capabilities. The American Samoan Department of Health used quality improvement to establish evidence-based practices. They were able to build their capacity and increase health resources by assessing their abilities. By conducting an inventory, they found inconsistencies and a lack of knowledge in how to use evidence-based practices. Quality improvement helped them create a method of prioritization, resulting in skill-based training, effective database training usage, and an applicable departmental framework for evidence-based practices. Montana-Wyoming Tribal Leader Council was able to identify strengths and gaps by using the National Public Health Preparedness Standards Assessment tool. The tool provided the tribes with a uniform evaluation process that could be done regularly. The assessment found a need for tribal health codes to be set up and enforced at the local level. This led to the development of tribal advisory boards with subcommittees in each participating tribe. The board is used to develop health codes and performance standards so that emergency preparedness and research could be evaluated, resulting in public health improvements. Lastly, Los Angeles trained staff to use performance assessments to track health indicators and measure their outcomes. The department is now able to enhance data analysis and reporting capabilities. The quality improvement increased their acute communicable disease control phone drill responses and their tobacco control and prevention and oral health referrals, while also helping staff and other stakeholders understand the cost effectiveness of health interventions. Purpose. Purpose of the study of this is to help a local EMS department improve their responses and establish training or retraining in the appropriate areas to continue the delivery of excellent healthcare in emergency situations. The study evaluates the degree to which an Eastern PA hospital's EMS meets the National Public Health Preparedness standards related to an MCI. The study identifies strengths, weaknesses, opportunities, and threats in an Eastern PA hospital's EMS performance during MCIs. The main research question here is, which standards does an Eastern PA hospital's EMS meet and which standards remain unmet? The findings for this study are used to generate recommendations. Delimitations. For this study, the focus was upon EMS personnel from an Eastern PA hospital only. Furthermore, the evaluation was concentrating on their MCI performance by evaluating their knowledge and capabilities of MCI responses. This assessment is designed to systematically emphasize one response type at a time in order to improve its delivery. Questions for the evaluation reflected best practices derived from relevant literature. The chosen questions also echoed the policies and procedures adopted by this Eastern PA hospital. Design of the study. Mixed methods were used to conduct a performance assessment, including quantitative and qualitative measures. The quantitative method for this evaluation was an online survey. Survey questions were based on MCI performance standards. These standards were adapted from the National Public Health Preparedness Standard Assessment to learn more about the knowledge base of EMS personnel, specifically as it relates to MCIs. Research conducted to create the MCI performance standards included reviewing previous literature, case studies, and policies and procedures. Once the survey response window closed, participants were invited to partake in a semi-structured interview. The interviews provided qualitative information to gauge to gauge participants' thoughts about MCI plans and responses, quality improvements, and how to best meet the identified performance standards. Post-discussion, participants completed a paper survey where they were asked to rate their EMS department's performance against the standards on a 4-point Likert scale. It's not exactly a Likert scale, but I didn't know what else to call it. So no activity was 0 to 25 points. Minimal activity was 26 to 50 points. Excellent activity, 51 to 75 points, and optimal performance or meeting the standard was 76 to 100 points. This 3-part design provided the Eastern PA Hospital's EMS department with a thorough assessment of their performance levels, particularly as it relates to their MCI responses. Participants. Table 1 outlines demographic information overall, including age, sex, years of service, and the position they held at the time of the assessment. The department consisted of 14 full-time employees, which 9 of them participated. Their positions varied from paramedics to advanced emergency medical technicians and just EMTs. The particular station that I was working with runs 2 ambulances regularly, but has a total of 4 in service. They also have a county issue MCI truck on standby. Instrumentation. For this evaluation, the National Public Health Preparedness Standard Assessment instrument was used as a guide and foundation. Adaptations were made to it based on personal communications with experts and a thorough review of the literature. Central services, modeled standards, and questions were adapted to focus on MCIs. Appendix A, which is on the right hand of the screen there, outlines the MCI focus areas, adaptation model standards, and survey questions. Data collection. Data were collected using multiple modalities. As I said, emails, interviews, and paper surveys. The first round of survey questions was sent via email using Gmail or a Google form. The format of questions included multiple choice, open-ended responses, and select all that apply. The second method of data collection was a semi-structured interview with each individual participant. The interview protocol facilitated discussion with EMS personnel and included all correct answers to the first survey, as well as additional educational information to help the participants effectively respond to MCIs. This discussion prompted participants to expand upon their Google form responses. Here, themes and challenges were recorded. Following that discussion, participants were given a list of 4-point Likert scale questions where they would indicate the level of performance relative to the modeled standards. After the data was collected, a composite score was calculated for each modeled standard based on participants' response to questions in Appendix A, Table 2. For example, in that table, 4.4 requested participants to rate the performance of an Eastern PA hospital's EMS in having a systematic flow to transport patients. Once all participants provided a score, an average score was calculated using all 9 of those responses. The mean score determines the relative level of performance for each model standard created. Then an overall composite score was calculated for each one of the 6 MCI focus areas derived from the model standard scores in that section. So for example, ratings corresponding to modeled standards 3.1, 3.2, 3.3, and 3.4 were averaged to generate an overall communication score. These scores determined strengths and weaknesses of the department. Additionally, descriptive statistics were used to analyze quantitative data collected from the online and paper surveys. By determining the number of participants who responded similarly, trends in the data were identified. For example, 77% of participants said they never had been a part of any type of drill or exercise for MCIs. Furthermore, gaps were identified from incorrect responses. The qualitative data were used for a similar purpose to identify themes in the open-ended responses. These themes guided overall recommendations and detect necessary in-person discussion points. With the results of this study, Eastern PA Hospital's EMS department can plan and train for individual MCI response capabilities, as well as the department's overall. The assessment will provide personnel with the baseline for continually improving their MCI response quality and effectiveness. Results. Of the 6 MCI foci that I came up with, participants had strong answers in activation and chain of command, communication, and departmental capabilities, whereas they had weak answers in MCI classifications, triage, and MCI preparedness. MCI classifications. It is critical for EMS personnel to understand the MCI levels of their region and policy, as this will indicate their entire response process. So 44% of participants accurately depicted the county's MCI levels. Furthermore, 66% of the EMS crews surveyed indicated an appropriate answer in calculating the number of ambulances needed to respond to a particular MCI. However, it was also identified that during interviews, the County Communication Center helps them in determining those things. Furthermore, all participants were able to identify types of MCIs. However, there was no consistency in what classified as a main type of MCI or the different types. The EMS crews could identify many hazards, but only 66% of them could differentiate the zones of care, meaning between hot, warm, and cold. It was identified that their performance activity is at an excellent level in MCI classification with a composite score of 61.11. Based upon the created modeled standards, on average, the EMS personnel rated all activities in the excellent range. While all these activities are labeled in the excellent range, the scores show that there's still substantial room for improvement, especially since we want to reach optimal performance. Chain of command or activation and chain of command. The discovery process revealed most participants did not know where the policy was located or if one even existed. Furthermore, most participants do not review the policy regularly within their careers. On the other hand, 77% of the EMS personnel know their roles and responsibilities, as well as about 89% were able to describe the chain of command. Through discussion, the participants showed they understood EMS has vast duties in triage, treatment, and transportation of victims. In reviewing the data, it was discovered that their performance activity is at an excellent level in activation and chain of command with a composite score of 63.89. Based upon the created model standards, on average, EMS personnel rated their activity and familiarity with MCI in the minimal range. Yet the hierarchy approach, scene command and control, and scene survey were all ranked in the excellent range. Communication. Communication is key to success. 77% of the participants demonstrated the process of communicating through the County Communication Center and specific roles within the chain of command for MCIs. While about 22%, the rest of them gave more broad answers, such as how to use radios. Either way, 100% of the participants demonstrated an appropriate use of communication. Furthermore, 77% of EMS personnel understood the importance of communicating with hospitals throughout an MCI process. Participants also understood the importance of identifying and choosing roles for an MCI. About 89% stated that they used colored MCI vests, and roles are determined by either seniority level or time of arrival at the scene. Based on responses, it was recognized that performance is at an excellent level in communication with a composite score of 66. Based upon the created modeled standards, on average, the EMS personnel rated all activities in the excellent range. Triage. Triage is the backbone of a successful response. A little more than half of the participants were able to indicate their policy's correct form of triage, which in this case was the SALT method, but the other half selected START, which is a very similar triage method. Triage tags are useful in sorting victims, but only if EMS personnel understand their meanings and how to use the tags. 100% of the EMS participants were able to demonstrate both of those things. However, there were some discrepancies in knowing the triage tools at their disposal and where the equipment is located on the ambulances. 6 out of 9 of the participants were able to confidently answer that question. Excuse me. Although during the discussion, it was admitted that different types of ambulances have different equipment and they're located in different places. And since the EMS crews rarely touch it, they didn't have that great of familiarity. Additionally, about 89% of the participants understood the necessity of staging a transportation officer to bring ambulances in and out of the scene smoothly, as well as strategically sending victims to the appropriate hospitals. After retrieving the data, it was discovered that their performance activity is at an excellent level in triage with a composite score of 62.04. Based on the created modeled standards, on average, the EMS personnel rated using the SALT triage in the minimal range. The remaining modeled standards were all rated in the excellent range. Departmental capabilities. When asked about their unit's limits, participants based their responses off of personnel, victims, and supplies ready on their ambulances. These were similar responses when asked about their station's limits. The EMS personnel were very engaged in discussion about capabilities and are very in tune with their coworkers. However, when it came to neighboring agencies in the area, the participants gave very vague understanding of their neighbors' limitations. There were many answers similar to the supplies that are available on their trucks. Nevertheless, respondents did discuss how they work at other stations besides this Eastern PA hospital, and how they partner with other services in daily operations such as motor vehicle accidents. So in reviewing the capabilities data, it was discovered that the EMS personnel's performance activity is at an excellent level in the departmental capabilities with a composite score of 71.30. Based upon the model standards, on average, they rated knowing your unit's capabilities in the optimal range. The other two were rated in the excellent range. MCI preparedness. Finally, MCI preparedness is what will support improvements for EMS responses. When asked when the last time they exercised for an MCI, the participants answered as follows. 1 out of 9 participants said within the past year, 3 out of 9 said within the past 3 years, and 5 out of 9 of them within the past 10 years or more. 77% of participants said they had never been a part of any exercise for MCIs while being an Eastern PA Hospital's employee. EMS personnel were asked if they practice triage regularly. Only 22% of them said yes, whereas the remaining 77% said no or sometimes. To follow up, participants were asked when they last practiced MCI triage. 1 out of 9 respondents said within the past 2 weeks, whereas the rest said within a year or more. Furthermore, when it comes to reviewing MCI response plans, only 44% of the participants answered that it is reviewed. Even after an MCI occurs, only 66% said that they review it in some form of capacity. Finally, respondents were asked when they last participated in like a real MCI. Most answered that they had never been a part of a live MCI to date. The most recent MCI participant took part in was in the year of 2017. So key findings. Out of the respondents, the mean age for EMS personnel at an Eastern PA hospital was 36 years old. Most of the participants had been in EMS for at least 10 years. Respondents varied when asked about MCI types and zones of care, but many of them were able to demonstrate a systematic approach in assessing scenes during the discussion. The 360 survey was identified as an easy and useful tool for assessing scenes because it looks at the situation from all angles. Based on responses throughout the study, weak answers appeared to derive from policy-specific questions, but when asked about practical fieldwork, responses tended to be stronger. For example, respondents were able to describe their roles as EMS in an MCI, but struggled to know if an MCI policy existed because it's not regularly reviewed. While only about half of the respondents selected the correct triage method according to policy, all of them were able to differentiate the triage tag colors and their meanings. Color coding methods appear to resonate strongly with the participants. Findings of concern. Based upon participants' answers in the follow-up survey, it appeared that some of the perceptions of performance are higher than what may actually be true. For example, 7 out of 9 participants had either never been a part of an exercise for an MCI or had not been a part of one in recent time. Moreover, 9 out of 9 participants had never been involved in a real MCI, while the remaining 4 had not been involved in one since at least 2017 or longer. This means that the knowledge they profess has never been tested, or in other words, their field performance has never been measured. This perception can be threatening to the department's capabilities during a real MCI. Additionally, most of the respondents do not practice triage regularly. In addition to practicing MCIs, the Eastern PA Hospital's EMS are unfamiliar with the MCI policy. As mentioned, respondents did not know where to find the policy and rarely reviewed it. Most reviews that occurred on MCI response plans are informal and used more of a debrief for the EMS crews instead of being used to identify gaps and improvements on their response plan. Interpretations. These findings speak volumes to the aging EMS profession, as it is on par with the National Association of State EMS Officials 2020 National EMS Assessment, which stated that the mean age of EMS personnel ranges between 30 and 39 years old. This shows a need for more service people to join the field, as EMS is a critical infrastructure of the healthcare infrastructure. Or I should say, I'm sorry, a critical function of the healthcare infrastructure. Without a cycle of younger service people, documentation of emergency events, and routine practice experience, it will be lost and gaps will widen over time, threatening the advances in emergency responses. For the varied responses, there was minimal overlap, which may suggest that respondents are not currently receiving the same information upon hire, or their training is not frequent enough to ensure all employees have the most up-to-date information readily available to them. This appears to be evident based on their answers to policy questions, considering most participants didn't even know a policy existed. The MCI policy is there to assist EMS personnel in activating and operating an MCI. The MCI policy should be regularly reviewed and used as an opportunity to support the EMS personnel with their responses. Another form of communication that appears to work well for an Eastern PA Hospital's EMS is using visual representation for responsibilities and work performed. Color coding these things resonated with the participants well and appeared to be a strength for them. This may be advantageous because it guides personnel's attention to forming a stable chain of command and keeping everyone on the same page. Based on discussions and answers to survey questions, it appeared that triage methods are taught at EMT school, but never reinforced once employed at an Eastern PA hospital. This leaves the EMS personnel with using the method they were originally taught, resulting in no standardized triage method in the field for that organization. When it comes to MCIs in general, there is minimal exposure and a lack of consistent training as reported by employees. It is unclear whether staff are truly prepared to respond if an MCI were to occur because they do not practice. Without practicing or training, it leaves the department vulnerable to failures and mistakes. Limitations. This study had several limitations that may have an impact on the results as well as the quality of information discussed. One of the major limitations was that EMS personnel were only interviewed during their shift, which was interrupted multiple times due to incoming 911 calls. The interruptions may have caused good conversations to go astray. Another limitation resulted from the use of email surveys. Because of that, they may have been able to look up answers or to collaborate on questions, skewing the results. Lastly, the scores range between 25 points for each descriptive label in that second survey. It made it difficult to interpret the level of performance. While the general performance is still measurable this way, it made it difficult to pinpoint specific gaps. So improving the study, while there's always concerns about accuracy, all the limitations can be minimized with a proper setting and less interruptions. Limiting interruptions and distractions will improve the study for future assessments. So it's suggested to use a retreat style for optimal results. Furthermore, it's suggested that participants give a numerical grade for the second survey instead of a descriptive one. That way the facilitator can have a better idea as to where participants fall in the performance of the activities. Then the facilitator can assign a label to that numerical grade later on. If a descriptive grade is preferred, it's recommended that to use a limited score range of 4 or only 5-point scale. Implementations. So while many of the Eastern PA hospitals EMS activities are rated in the excellent range, the goal is to have all functions in the optimal range. MCI preparedness was the worst and rated at a minimal performance level. It is recommended that MCI drills or exercises be conducted regularly with the help of EMS personnel, which would help EMS personnel improve their responses. Whether exercise or whether experienced or inexperienced, these exercises give participants the opportunity to practice an infrequent event and put response plans to the test. An MCI exercise should occur once a year with other training or drills designed to strengthen specific areas, maybe such as MCI classification or triage, at least semi-annually. One drill that is definitely recommended based on the results of the study is triage. While triage was scored in the excellent range, there still seems to be some gaps and doubts in the EMS's performance abilities. Only 2 out of 9 participants indicated that they practice triage regularly. While simple, triage is a skill that can be easily forgotten if not practiced. The program Triage Tuesday is recommended for an Eastern PA hospital's EMS because it is a drill that can be utilized anytime. The idea behind this program is to pick a day, such as Tuesday, and have the participating EMS use a triage tag on every patient that they transport to the emergency department. This program can also include the emergency departments that they transport to in order to help clinical staff practice triage in the event that their hospital would be involved in the MCI. Another recommendation is to have personnel review policies and procedures more than just upon hire. These documents should also be reevaluated yearly for all of their EMS personnel. This could also include reviewing the ambulance's organization to reorient crews with the resources they have and their locations. To assist the EMS personnel through a stressful situation, the department should create MCI checklists to put in the ambulances to guide EMS crews during an MCI. It should guide EMS personnel in how to classify and activate an MCI. It should also contain chain of command system and contact information for participating bodies such as nearby hospitals. Furthermore, these lists can describe the location of necessary triage equipment in the ambulance and show them how to use it. Lastly, the study should be used as a baseline to track improvements of an Eastern PA hospital's EMS department. The department should implement the recommendations and reassess after implementations are put into practice. Reassessments should be continuous and used constantly to improve the responses of MCI for the EMS. This will help EMS system improve their pre-hospital responses to MCIs. So in conclusion, all disasters, what's happening here? Hold on. There we go. Sorry about that. My computer glitches. I have a very old computer and it has a mind of its own sometimes, so I apologize. So all disasters require some level of preparedness. An MCI is a wide-ranging and diverse disaster that is often difficult to predict. When it comes to preparing for MCIs, the public health field needs the mindset of not if, but when trying to navigate. National Public Health Preparedness Standards created a performance assessment to improve the public health system. To improve specific aspects of the public health system, the same method was used to assess the Eastern PA Hospital's EMS department as it relates to MCI response. I'm just going to stop sharing my screen because it's just the final slide. Um, However, most of the participants, they had high perceptions of their performance. So it's recommended that they implement MCI exercises into their yearly training to really test those perceptions to see if their perceptions are accurate. This would help practice and improve their skills, but also put, like I said, their perceptions to the test. Um, when it comes to MCIs, preparedness is key. Without a strong and well-rehearsed response plan, disasters are ensured to be disastrous and tend to have a slow recovery process. So that concludes my whole project. I know it was a mouthful. I would be happy to answer any questions. I know I used most of the time, but I'd be happy to answer any questions. And if you have any questions about like how you should go about your capstone or things that like I wish I would have done differently, or if you were surprised by any of the results, please let me know.
Austin, thank you so much for that. That really was great. I know Dr. Langridge has to jump off in a few minutes, but he put a question in the chat, so I want to jump to that real quick. Fantastic work and presentation. You took on a difficult capstone. I'm wondering if there are virtual reality training programs from EMS MCI. Seems like your respondents were good with practical skills and tasks. Therefore, VR may be especially strong for EMS workers.
Yeah, that's a great point. I don't think that was even something I kind of considered. I know at the hospital that I worked at, I don't think that that's something they even engage in. Based on the responses I was getting for a lot of the stuff, it didn't seem like they were focused on it at all, just because it's such a rare event.
I know he's not logged in tonight, but that's something that JD is looking at, so he would be definitely very interested in that.
Yeah, so some of my kids have introduced me to virtual reality here, and so the couple of games that we played is, there was a plane crash and we had to avoid all these dinosaurs and things like that. And we also another game was climbing mountains and rock climbing, things like that. And of course I would fall immediately. So it just seems like virtual reality would be a great way to run the EMS training and exercise. You could they could do all these things that you're asking. Communication, where do you find the policy, how do you tag, how do you do triage, and it would just be a great place to kind of walk down the road. And if it were me, I'd be making all kinds of mistakes and crash and have to start all over again. But it just seems like such a right place for virtual reality.
Yeah, I definitely think it's something that maybe even now I can also recommend to them as an additional piece. They do have a lot of, it's either they have very experienced people or very inexperienced people. There's no in between. So that would be good for all of them.
Yeah, it would take, of course, quite a bit of programming to make that happen. But I could just see that being it would be a neat training opportunity for EMS in these mass casualty incidents.
Well, I have been talking, I was thinking about JD for eventually doing a webinar, and I actually introduced him to somebody who is doing some incredible work in this field. So, and then I spoke to the guy about something unrelated the next day, and I told him that I might try to pick his brain one day because he's doing a lot of virtual reality and esports stuff with military people and mental health. But he's doing a lot in that VR world. So between him and JD, we should be able to get a good webinar out of it eventually. Austin, we have another question from Savannah. Unless, Jean, do you have another question before you have to? Bye. So Savannah had a question. Great work. I enjoyed your presentation. I noticed that for your study population, 66% had 10 plus years of experience. Do you think your results would differ if more individuals with less than 10 years of experience participated in your study?
Yeah, I think it would have. Um, um, even the experienced guys were struggling on a lot of things that I was asking them. I know it was kind of brief, that appendix um, photo I had in one of the slides. It was a lot longer than that. That was just like one section. And the experience is being lost. It's a major issue for EMS. I was talking to their manager, and these guys who have 10 plus years are super experienced. They've been involved in a lot of different things. I know a lot of them haven't been involved in MCIs, at least in uh, the department I worked with for this. But they still had experience in other capacities that helped them answer questions related to MCIs. And so I think I had a few people who were just starting out in EMS and they had no idea. So the other concern is that seeing the gap widen there over time means that a lot of these new people aren't getting the I don't know how to say it, but the experience from the older people, like it's not being passed down. And it's only getting worse over time. So if they experience an MCI without those veterans, it could have a significant negative impact. And basically, to answer your question too, I think that you would have seen, like a lot of the scores were in the excellent range. I think you would have seen more in the minimal range.
I have Okay, Savannah said, very interesting. Thanks. Great work again. I have a question a little bit more about the process. So it's great that you were able to do a capstone like this. It was able to be something that had practical implications almost immediately. So do you have any advice for students, like how you went about finding this project? If there's anything you wish you did differently, anything like that?
Yeah, so I was lucky that it kind of fell in my lap this way, and I at first I wasn't really going to do it, but I strongly recommend getting with faculty and talking to them about it. Dr. Gavin was huge in helping me kind of figure out how to navigate this into a capstone. Originally, it was basically they just wanted me to come up with checklists for them, looking at their policies and procedures and finding that important information specifically related to their EMS crews and putting it in like
Did everybody
in
lose Austin or was it just me?
Yeah, you caught up there, Austin.
Austin, can you hear us? Let me see. I'm going to send him a chat message.
We can hear each other. We can't hear Austin.
Yeah.
hello.
Oh, Austin, is that you?
We hear you
Yeah,
there.
sorry. I have such crappy internet over here. So I don't know exactly what you heard and what you didn't, but basically get with a mentor. That really helped. One of the things you're gonna run into roadblocks. I think I had to change my process maybe twice. And being that it's within a semester, it really limits you. Like you don't have a full year to work on this. I mean, unless you start working on it prior to the actual class. Unfortunately, I couldn't really start working on this till I started the capstone course. So if you have the time to like start doing it before you even take your capstone course, I recommend that. But I know everyone's busy and doesn't have time for that. So, plan for, give yourself wiggle room when you're doing these. Because if you don't give yourself any wiggle room throughout the semester, you're gonna have issues. And one of my big issues was when I was creating the standards and the questions to ask them, I couldn't do, I can't think of what it would be called, but like a mock run to see how it went. And I definitely realized, like,
Oh, Austin, I'm not sure if you can hear us.
Yeah, I can't hear him again either.
Yeah.
I can't hear him either.
I don't know if he can hear us or if he just can. I'll send him another message. He's losing his signal. I can even ask him the question via email and then just send it out.
can you hear me now?
Oh, now we can hear you.
I should work for Verizon or Sprint or whatever. So I can also send it in an email or something since I keep cutting out, but give yourself wiggle room and as I realized that there were issues with understanding the questions I was asking them. So if you can get a sample going and then see how it goes with some participants, and then, reevaluate and be like, okay, I should reword this question. That would have been very helpful.
All right, that's great. I won't keep you if your internet is cutting in and out, but I just really do want to say thank you for your presentation. It was great. And it's always great to highlight what our students are doing, but it's also great to be able to highlight something that I know a lot of our students do want to be able to do something, as I mentioned, with a practical application. So being able to highlight that was really special as well. So thank you so much for speaking tonight.
Yeah, thanks for having me and let me talk. Yeah, it was a great experience. It definitely had real impact because they implemented all the recommendations that I gave them. So I was able to see improvements right away. I definitely want to meet up with them again. It's been a while, so I kind of want to hear how they're doing. But as soon as I had talked to them about MCIs, they made it a part of their training program in that year, the fall of that year. So,
Great.
and if anyone has any other questions, you can always reach out to me, email, or if they want to reach out to you, and I can always send emails over or get back to you on any questions you guys have.
All right, sounds great. So for Mike, do you have something?
No, I was just going to say congratulations and great work.
Thank you. I appreciate it.
I just want to remind everyone, I know I already talked about May 4th being our next PHP webinar, and we're going to have the presentation on the National Guard. I did forget to mention before that we are having the next IAEM meeting on the 19th, April 19th. It's always the third Tuesday of the month. So if anybody is interested in that and you're not already on the mailing list, please get in touch with JD or with me, and we can send you that information. So again, Austin, thank you so much for your presentation, and best of luck with your remaining wedding plans.
Thanks. I appreciate it. Hopefully it all runs smoothly now.
And even if it doesn't, you guys can still enjoy the process and you'll still be just as married. But hopefully it does go smoothly for you.
Yeah, I appreciate it. Thank you.
All right, well, everybody have a great night, and we will see you this time next month.